My name's Amy Long. I'm a licensed professional counselor here in Colorado Springs, and I'm here to talk to you today about neurofeedback and how it can be helpful for a lot of folks who are struggling with a lot of different things. So, neurofeedback is a way for us to learn how to regulate our own brain and how it works in a way that helps us to function better so that we don't struggle as much with some things. So, what we do is we place a sensor on the scalp, and that helps us to record the electrical activity that's happening in the brain. And then that information goes into the computer, it gets analyzed in all kinds of fun ways, and then it comes back out in the form of audiovisual feedback to the client. So the audiovisual feedback can take lots of different forms. It might be a movie or it might be a video game. But for instance, in the case of a movie, when the brain's doing what we want it to do and it's functioning well, the movie screen clears up and it's just like a regular movie. When the brain's not doing something the best that it could, the movie screen blurs out a little bit. So over time, your brain is really motivated to keep that movie screen clear, and it figures out how to work in a way that keeps that screen clear. And then it realizes that it works better in other areas of life too, and so that starts to generalize even outside of the session. So neurofeedback is generally a permanent treatment. So once your course of treatment is done, there's generally no more treatment that needs to occur unless some other insult to the brain occurs, like a traumatic brain injury or something like that. And depending on the complexity of what's happening, it can be anywhere from 20 sessions to maybe even 100 sessions in order to resolve the presenting complaints. But basically, neurofeedback is just learning how to control your brain in a way that works for you. Neurofeedback can be used to treat a variety of different conditions. The one that's been most well researched to date is ADHD, or attention deficit hyperactivity disorder. There's a wealth of research. This treatment is actually recommended by the American Academy of Pediatrics as a frontline treatment for ADHD. And it can help with all of the different symptoms that you see in ADHD, things like difficulty with organizing or planning, difficulty with impulsive behaviors or hyperactivity in the classroom or at home, emotional impulsivity, those big emotional outbursts that we tend to see in ADHD. Neurofeedback can be helpful with all of those symptoms, and it's very, very effective treatment that's been well researched with controlled studies. Neurofeedback can also be used to treat a variety of other conditions. They haven't been as well researched, but there's a lot of really good indication that it can be effective for things like anxiety, depression, autism spectrum disorders, traumatic brain injury, and now we're even finding some evidence to say that it might be helpful in some medical conditions like stroke. So there's a lot of good case studies, a lot of small sample size studies to suggest that it's effective for these conditions as well. One of the most frequently asked questions that I get is, how do I actually make this work? What do I do when I'm actually hooked up and training? And the answer is absolutely nothing. This is a completely unconscious process. It's not something that you have to think about or work at. As long as you're paying attention to the feedback that you're getting back through the computer, it's going to work. So this technology was actually first developed on cats. So you don't have to give it any more thought than a cat would. That doesn't mean it can't work, but it's not likely to work as well or as quickly in those conditions. The other thing is, if there's a traumatic brain injury in place, that limits the types of treatments that can be done because some of the treatments increase a particular type of brainwave pattern that we have too much of when we have a traumatic brain injury. So sometimes some caution needs to happen in cases like that. So another question that I get asked all the time is, who is neurofeedback good for and who is it not good for? One of the wonderful things about neurofeedback is that it really works for almost everybody. It works for young kids, it works for older adults, it works for a wide variety of conditions, but there are a couple factors to keep in mind. Because neurofeedback is basically learning, it's something that needs to happen consistently. you wouldn't want to try to learn to read once a month. It just wouldn't work. Um, Similarly, you don't want to be under the influence of marijuana, alcohol, or any other type of mood altering substance, because that really interferes with your ability to learn. The only other conditions that can be problematic, although they're not necessarily prohibitive, is like having a medical procedure where you might end up with like a metal plate in your head that interferes with our ability to register the electrical patterns in your brain. Um, any type of seizure disorder can be problematic, or a history of traumatic brain injury. Although neurofeedback is really effective for traumatic brain injury, some of the other types of treatment, like ADHD treatment or anxiety treatment, might not be possible if there's a traumatic brain injury in place. Another question that I get asked is, how long does treatment take and is it permanent? The good news is, yes, it's absolutely permanent. Unless there's some other insult to the brain that occurs in the future, like a traumatic brain injury or a seizure or a stroke or something like that, results are generally permanent. How long does it take? That really depends on what's being targeted and how many conditions are being targeted. It can really be as short as 20 sessions or as long as 100 or more, although that's pretty infrequent that it takes that many sessions. So for single disorders, 20 to 40 sessions is generally expected. When you have more than one thing going on, it can often take longer than that. One of the other concerns that people sometimes have is whether or not this treatment is going to hurt because electricity is involved. It's just important to know that we're not putting any electricity into the brain. We're just measuring what's already there. So there isn't any pain or discomfort with this at all. And again, it's just learning. We're not actually doing anything to you, so there's really nothing there to hurt. Kind of along with that same idea, people wonder if there's any negative side effects to this treatment. Side effects are very, very rare and very minimal when they do occur, and temporary when they do occur. So for instance, sometimes if a training site hasn't been selected well or a person's very fatigued, sometimes they can end up with a slight headache which lasts maybe 24 to 48 hours at the worst. Every great once in a while, people will report things like an increase in agitation, feeling of agitation, or those kinds of things. And when those do occur, that tells us that we're doing something not right in the brain, that we need to change our approach. So it gives us good feedback, and again, it only lasts maybe 1 to 2 days at the very most. So in addition to the video game or the movie that can be used as feedback, we also have something called tactile feedback, which is represented by this teddy bear. So this is really great for kids because they get to hold the teddy bear and snuggle it during session. And what it does is it vibrates when your brain is doing better, when it's doing what we want it to do, and it stops vibrating when your brain stops functioning as well. So sometimes kids will just get this tactile feedback because they can't focus maybe on a video game or a movie, and this is a great place to start for individuals like that.